Lieutenant Governor Becky Skillman has championed strengthening of infrastructure in our great state of Indiana. And one of the infrastructures that she's helped benefit from that in her work is information technology. Here at our hospital, the information technology improvements that we've made have allowed us to improve and expand on the care that we provide to those who live in our area. And we've done this through our electronic medical record and through the telehealth medicine program that we've engaged in here. With our electronic medical record and the telehealth networking program, our healthcare providers and their patients are no longer bound by the constraints of our location. The telehealth network allows specialists to be able to consult with our healthcare providers here so that they can improve the healthcare that they give to our patients on a more real-time basis. So these efficiencies and advancements have actually allowed us to be named one of the top 20 critical access hospitals in the nation this year. So we think that's a great honor, and it's all due to that improved telecommunications and telehealth networking. On behalf of all my colleagues, I want to thank you for the support and the involvement of everyone present today in strengthening healthcare in our communities and beyond. One of the partners in that effort has been Enhanced Telecommunications Corporation. So I'd like to introduce Chad Miles, who is their president and CEO.
Well, good afternoon. I'm Chad Miles, president and CEO of Enhanced Telecommunications Corporation. Certainly my pleasure to be here with you all today. I certainly appreciate the opportunity to visit a very important business partner in Decatur County Memorial Hospital. For those of you that don't or aren't familiar completely with our company, we're a locally owned, family-owned and operated local exchange carrier. We provide voice services, video services, and today the primary focus is broadband to Decatur County Hospital through the Telehealth Network, also the city of Greensburg, Decatur County, and several other counties in southeast Indiana. We have right around 100 employees, and we have been in business, 2 years from now we'll have been in business for 80 years. So we've gotten very good at delivering broadband to the most rural parts of the state. That's been our company's focus. And it's always been our belief that, that folks in rural areas should have access to the same technologies in rural Indiana as they do in metropolitan Indiana. When I mentioned Decatur County, I mentioned them as our business partner. And I mean that in a way that it's, yes, they are a very important customer of ours, but we don't see them as only a customer. We see ourselves as a partner in everything that they do. You know, they are running a top-notch hospital. We believe that, that they had a great demand to have access to the most innovative, technology-savvy network that could possibly be built, and we wanted to fill that role for them. But we're also looking at this as not delivering broadband to Decatur County. We're looking at this as enriching or improving the lives of the folks in the Greensburg area and the Greensburg community. As I said, we believe that folks choosing to raise their children, raise their family, and work in rural Indiana should have those same opportunities technologically as they do in Indianapolis. So we're very dedicated to making that happen. The problem with that is it's hard to make it affordable. So through partnerships with the IRHA, the support of Lieutenant Governor, Decatur County Hospital, we've been able to make that happen and make it affordable. I also have to mention that our connection with the Indiana Fiber Network also makes this network sustainable. When we built this fiber into Decatur County Hospital, we acknowledged the fact that their broadband consumption was going to grow over the years, and so we needed to put a pipe in that was robust and scalable and gave us the ability to continue to meet their needs. So again, I'd like to thank the support that we've had with Decatur County. They've been wonderful to deal with over the last, 14 months ago we were here and kicking us off. Been a fantastic customer. Lori Feldbauer in my office, who is the point of contact for all these folks and make sure that we have all of our people in line and making sure they're getting things done properly. Lieutenant Governor Becky Skillman, who has just been a fantastic advocate for this network, and it's a great piece for our state. So with that, I will conclude, and again, thank you for allowing us to be a part of it. We're very excited to be a part of what's coming next, and very proud to be a partner with Decatur County Memorial Hospital. And with that, I will introduce Becky Sanders, the director of the Indiana Telehealth Network, who I would say is also an influential piece in making this all happen.
I'd like to say thanks again for joining us today. It is awesome to be able to stand here thinking back a year ago and how far we've come just in the last year. We did an inaugural lighting of the fiber last year in October here at Decatur County, and at that time we were just signing contracts, just getting through our first RFP, and now we're getting ready to file our third RFP. We've got almost 60 different hospitals, clinics, community mental health centers involved in the Indiana Telehealth Network now, and it's just growing and expanding exponentially. When Don came to me, 3.5 years ago and talked to me about this position, I had no idea where it was going to take me. But it's been a wonderful journey. We've had many trials and tribulations, a lot of sweat and tears, no blood. But we've made it a long way in the last 3.5 years, and it's just awesome to think about where we're going to be in another 3 years. Again, I want to thank both Linda and Chad. Both of their organizations have been great to work with. But most of all, I want to thank Lieutenant Governor Becky Skillman and the Office of Community and Rural Affairs. I truly would not be here today without their assistance. We started off with this program, and there was no administrative support for this particular program. The only way that it made it possible for the Indiana Rural Health Association to continue this work and to do what we've done is through a rural development grant that we had with OCRA. There is absolutely no way we would have made it to this point. So thank you very much. And without further ado, I'd like to introduce Lieutenant Governor Becky Skillman.
And it's good to be here with so many partners in progress. That includes our fellow policymakers at the State House, Representative Randy Pride, good to see you again, and former Representative Cleo Duncan, with whom I served in the General Assembly. It was still during Cleo's time that we first started talking about this project and the great advances that could occur statewide. So always appreciate the good support we get at the State House level for implementing innovative and creative policies and practices. I am here today as part of my Hoosier Crossroads Tour, where we're here to witness the progress in Decatur County and at Memorial Hospital, and also with our telehealth network. I think many of you know, because you were here 14 months ago, that this is where we kicked off the statewide initiative. We held a statewide press conference right here in this room to tell all Hoosiers about the advancements we plan to make. And it was just 2 months ago that I and many of us in this room were in Williamsport at St. Vincent Hospital, then celebrating the most recent addition to the telehealth network. So we're very proud to see this network continue to expand and to serve more and more Hoosiers. I understand, and Becky mentioned too, that we have about 60 facilities online now statewide. And I think we all know that broadband is the most reliable way to move health information from point A to point B. And when we provide that level of communication to our healthcare providers, that takes this already excellent healthcare system to a whole new level of service. And bottom line is, this network opens the doors to doctors and to patients. It allows them to access specialty services, not only anywhere in the state, but anywhere in the country and in the world. We know that telemedicine makes it faster and easier to diagnose and to treat patients. And I've had a little update on this particular hospital. I know that you've made great advances by having a connection to IU Health, and particularly for your stroke patients now. You can provide faster treatment and more effective treatment. I also know that you're connected to mental health professionals in the Bloomington area. So these are great advances for the people of Decatur County and for this entire region. This network too could take away the need for more rural patients to have to travel to see a doctor. I think especially in our smaller cities and towns, the distance to an urban facility can actually be a barrier to getting the proper treatment. This telehealth network will take us a long way in that regard. We know too that the healthcare facilities that participate in telemedicine, they have a great return on their investment. And that's not only a return financially, but it's also a great return in the doctor and the patient convenience and satisfaction. So I would just sum up by saying this telehealth network moves us light years forward for our rural communities, for our healthcare system, and for our ongoing statewide development. So I'm very pleased to be back here, witness the progress of Memorial Hospital, where it all started 14 months ago. So thanks so much for being here today.